Medical Assistant Exam 100 Tricky Questions and Answers. Question 1. The care team in an infection control audit asks for guidance because a prothrombin time test is ordered. Which tube should be selected? Option A, gray tube. Option B, lavender tube. Option C, blood culture bottle only. Option D, light blue tube. The correct answer is option D, light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Gray fluorite oxalate is not the standard additive for coagulation studies. Lavender EDTA is used for hematology and can interfere with coagulation testing. Blood cultures detect microorganisms and are not used for prothrombin time testing. Question 2. An office review in an internal medicine office shows that a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A, include unrelated patient charts in the same fax. Option B, verify the recipient fax number before sending. Option C, send it to a number from memory without checking. Option D, leave the fax confirmation on a public counter. The correct answer is option B, verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Only necessary information should be disclosed. Memory errors can lead to misdirected protected information. Confirmation pages may contain protected information and should be handled securely. Question 3. An office review in an exam room shows that a waved glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A, record patient results without documenting controls. Option B, resolve the quality control problem according to protocol. Option C, use the meter because patient samples are different. Option D, change the patient's diagnosis to match the meter. The correct answer is option B, resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Quality control documentation is part of reliable testing. Failed controls must be addressed before reporting patient values. Medical assistants do not diagnose and should not alter clinical information to fit a device. Question 4. During a clinical skills review, the term gastroenterology appears in a referral. Which specialty is involved? Option A, endocrine glands. Option B, digestive system. Option C, nervous system. Option D, urinary bladder only. The correct answer is option B, digestive system. Gastroenterology focuses on the digestive tract and related disorders. Endocrinology focuses on hormone-producing glands. Neurology focuses on the nervous system. Urology focuses on the urinary tract and male reproductive system. Question 5. At the start of care in a medication administration visit, an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A, IM. Option B, 4. Option C, PA. Option D, subcut. The correct answer is option C, PA. PA means by mouth and is used for oral administration. IM means intramuscular and refers to injection into muscle. 4 means intravenous and refers to administration into a vein. Subcut means subcutaneous and refers to injection into tissue under the skin. Question 6. After reviewing the situation in a specialty referral visit, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A, leave the old pharmacy because it is already in the chart. Option B, delete all pharmacy information from the record. Option C, choose the pharmacy closest to the clinic. Option D, update the preferred pharmacy after verifying the new information. The correct answer is option D, update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. Outdated demographic information can delay medication access. Removing needed information can interrupt prescribing workflows. The preferred pharmacy should come from the patient rather than staff convenience. Question 7. An office review in a women's health clinic shows that a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A, tell the patient the reading is probably wrong. Option B, ignore the anxiety to avoid making it worse. Option C, acknowledge the concern and explain the procedure in simple terms. Option D, promise that the provider will not be concerned. The correct answer is option C. Acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Dismissing the result can reduce confidence and may be clinically misleading. Ignoring patient concerns can increase anxiety and weaken communication. Promising an outcome goes beyond the assistant role and may be inaccurate. Question 8. Before the visit continues in an electronic health record review, a minor arrives without a parent for a non-urgent visit. Which action is best? Option A. Refuse all care without considering exceptions. Option B. Follow state law and office policy for consent requirements. Option C. Assume all minors can consent to every service. Option D. Ask another patient in the waiting room to consent. The correct answer is option B. Follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Some laws allow minors to consent for certain services. Minor consent is not universal for all services. Other patients cannot provide consent for the minor. Question 9. During a cardiology practice, the assistant reinforces instructions for a Holter monitor. Which point is important? Option A. Submerge the monitor in water. Option B. Remove electrodes whenever symptoms occur. Option C. Keep a diary of symptoms and activities as instructed. Option D. Ignore the return time. The correct answer is option C. Keep a diary of symptoms and activities as instructed. A symptom and activity diary helps correlate events with the recorded rhythm. Water can damage the device and create safety risks. Removing electrodes can interrupt recording when data are most important. The monitor must be returned as scheduled for data review. Question 10. During a telephone triage workflow, a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A. Pack the nose with contaminated gauze. Option B. Sit upright and lean slightly forward. Option C. Lie flat immediately without assessment. Option D. Tilt the head far backward. The correct answer is option B. Sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood while upright posture can reduce pressure. Contaminated materials should not be inserted into the nose. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Tilting backward can cause blood to drain into the throat. Question 11. In an infection control audit, an insurance plan requires approval before a specialist visit. Which process is being described? Option A. Autoclaving. Option B. Auscultation. Option C. Prior authorization or referral process. Option D. Venipuncture. The correct answer is option C. Prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Autoclaving sterilizes instruments and is unrelated to payer approval. Auscultation is listening to body sounds and does not approve visits. Venipuncture is blood collection and does not authorize insurance coverage. Question 12. After reviewing the situation in an internal medicine office, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A. Leave the patient alone until they stop coughing. Option B. Encourage coughing and monitor closely. Option C. Give the patient food to push it down. Option D. Perform blind finger sweeps immediately. The correct answer is option B. Encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. The patient should be monitored because the obstruction may worsen. Food can worsen the obstruction. Blind finger sweeps can push the object deeper and are not appropriate. Question 13. The care team in a patient intake station asks for guidance because a centrifuge is used in the laboratory. Which safety practice is important? Option A. Stop the rotor with a hand. Option B. Place only one tube at any weight in the rotor. Option C. Balance tubes before starting the centrifuge. Option D. Open the lid while it is spinning. The correct answer is option C. Balance tubes before starting the centrifuge. Balancing tubes helps prevent vibration, breakage, and equipment damage. Stopping a rotor manually is dangerous. Unbalanced loads can damage the machine or specimens. Opening a spinning centrifuge is unsafe. Question 14. During a family practice clinic, the provider requests an adult radial pulse during intake. Which technique should the medical assistant use? Option A, place 2 or 3 fingers over the radial artery at the wrist. Option B, use the thumb to feel the pulse. Option C, place the stethoscope over the abdomen. Option D, count respirations before locating the pulse. The correct answer is option A. Place 2 or 3 fingers over the radial artery at the wrist. The radial artery at the thumb side of the wrist is commonly used for an adult pulse. The thumb has its own pulse and can interfere with accurate counting. The abdomen is not used for a routine radial pulse. Respirations are measured separately and do not identify the pulse site. Question 15. Given the workflow in an outpatient laboratory, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A. Using sterile forceps for sterile supplies. Option B. Reaching across the sterile field with an unsterile sleeve. Option C. Opening the wrapper away from the body first. Option D. Keeping sterile items above waist level. The correct answer is option B. Reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile forceps can help maintain asepsis when used correctly. Opening the far flap first is a common way to avoid reaching over the field. Sterile items are generally kept in view and above waist level. Question 16. While working in an electronic health record review, the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A. Between. Option B. Above normal or excessive. Option C. Around. Option D. Below normal. The correct answer is option B. Above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Between is indicated by inter. Around is indicated by peri. Below normal is indicated by hypo. Question 17. As part of exam preparation in a certification exam scenario, the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A. Record the respiratory rate from the last visit. Option B. Ask the patient to breathe as deeply as possible. Option C. Count for 5 seconds and multiply by 12. Option D. Count respirations while the patient is unaware of the measurement. The correct answer is option D. Count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Current respirations must be measured during the encounter. Deep breathing changes the normal respiratory rate and effort. Very short counts are often inaccurate for respirations. Question 18. At the start of care in a medical office workflow, a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A. Blow on the site to speed drying. Option B. Allow the alcohol to dry completely. Option C. Touch the vein again with an ungloved finger. Option D. Draw blood while alcohol is still wet. The correct answer is option B. Allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Blowing can contaminate the cleansed site. Palpating after cleaning can contaminate the site unless proper technique is used. Wet alcohol can sting and may affect specimen quality. Question 19. To protect safety in a medical office workflow, the assistant reviews where bile is stored before release into the small intestine. Which organ stores bile? Option A. Pancreas. Option B. Gallbladder. Option C. Spleen. Option D. Bladder. The correct answer is option B. Gallbladder. The gallbladder stores and concentrates bile made by the liver. The pancreas produces digestive enzymes and hormones but does not store bile. The spleen is involved in immune and blood cell functions. The urinary bladder stores urine, not bile. Question 20. Before the visit continues in an outpatient laboratory, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A. Follow emergency triage protocol immediately. Option B. Schedule the patient for next month. Option C. Give a diagnosis over the phone. Option D. Tell the patient to send an email later. The correct answer is option A. Follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Routine scheduling can delay care for potentially serious symptoms. Medical assistants should not diagnose the cause of symptoms. Potential emergencies require immediate action. Question 21. Before the visit continues in a procedure setup, the assistant teaches a patient how to prepare for a fasting laboratory test. Which method best confirms understanding? Option A. Ask only whether the patient has any questions. Option B. Give instructions as quickly as possible. Option C. Use medical jargon to sound professional. Option D. Ask the patient to explain the instructions back in their own words. The correct answer is option D. Ask the patient to explain the instructions back in their own words. Teach back checks whether the patient understood the instructions and allows correction of misunderstandings. Patients may say no even when they misunderstand instructions. Rushing can reduce comprehension. Jargon can confuse patients and reduce understanding. Question 22. For a patient encounter in a telephone triage workflow, the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A. The assistant diagnoses pneumonia. Option B. Patient states, I have had a cough for 3 days. Option C. No documentation is needed for symptoms. Option D. Patient is definitely exaggerating the cough. The correct answer is option B. Patient states, I have had a cough for 3 days. Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Diagnosis belongs to the provider. Symptoms are relevant to the visit and should be documented according to policy. Judgmental wording is inappropriate and not objective. Question 23. Given the workflow in an outpatient laboratory, a rapid strep test requires a throat swab. Which technique is best? Option A. Touch the tongue repeatedly to collect saliva. Option B. Swab the outside of the lips. Option C. Collect sputum from a deep cough. Option D. Swab the tonsillar area and posterior pharynx while avoiding the tongue. The correct answer is option D. Swab the tonsillar area and posterior pharynx while avoiding the tongue. A proper throat specimen contacts the likely infected area without contamination from the tongue or cheeks. Saliva and tongue contact can dilute or contaminate the specimen. The lips do not provide the specimen needed for strep testing. Sputum is not the specimen used for a rapid strep throat swab. Question 24. During a telephone triage workflow, an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A. Wait for the provider before starting any response. Option B. Begin CPR and use the automated external defibrillator as directed. Option C. Use the defibrillator on a conscious patient asking questions. Option D. Give oral medication before checking responsiveness. The correct answer is option B. Begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. Delaying basic life support can reduce survival. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Oral medication is unsafe when cardiac arrest is suspected. Question 25. The care team in an internal medicine office asks for guidance because a tickler file is used in the office. Which purpose does it serve? Option A. Draw blood into tubes. Option B. Track future follow-ups or reminders. Option C. Sterilize instruments. Option D. Measure oxygen saturation. The correct answer is option B. Track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Blood collection uses phlebotomy supplies, not a reminder file. Sterilization requires approved equipment and process. Oxygen saturation requires a pulse oximeter. Question 26. To protect safety in a primary care office, the assistant needs to keep provider meeting time unavailable for patient appointments. Which scheduling tool is useful? Option A. Coinsurance posting. Option B. Sterile field setup. Option C. Matrix blocking. Option D. Order of draw. The correct answer is option C. Matrix blocking. Matrix blocking reserves time in the schedule for meetings, procedures, or other unavailable periods. Coinsurance posting relates to patient financial responsibility. Sterile field setup supports clinical procedures, not schedule blocking. Order of draw guides blood collection sequence. Question 27. During a treatment room, a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A. Tell the patient the practice is foolish. Option B. Ask respectful questions and avoid judgment. Option C. Assume all people from that culture act the same. Option D. Refuse to document relevant information. The correct answer is option B. Ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Judgmental language damages trust and may prevent disclosure. Stereotyping ignores individual differences. Relevant patient information should be documented according to policy. Question 28. Given the workflow in a women's health clinic, a patient becomes angry about a long wait time. Which response is most appropriate? Option A. Ignore the patient until the appointment starts. Option B. Blame the provider in front of the patient. Option C. Acknowledge the frustration and provide a realistic update. Option D. Tell the patient to calm down or leave. The correct answer is option C. Acknowledge the frustration and provide a realistic update. Empathy and accurate information can de-escalate frustration while maintaining professionalism. Ignoring frustration often makes the situation worse. Blaming coworkers is unprofessional and does not solve the issue. Commands can escalate conflict and harm patient rapport. Question 29. After reviewing the situation in a walk-in clinic, a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A. Use powdered latex gloves because they are easier to put on. Option B. Use latex-free supplies and clearly communicate the allergy. Option C. Ignore the allergy if the procedure is short. Option D. Tell the patient to bring personal gloves only. The correct answer is option B. Use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. Latex gloves can trigger a reaction in a latex allergic patient. Even brief latex exposure can cause a serious reaction. The clinic remains responsible for preparing a safe care environment. Question 30. When a patient encounter unfolds in a diagnostic testing area, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A. Pull the patient by the arms quickly. Option B. Ask the patient to jump to the table. Option C. Leave the wheelchair unlocked for easier movement. Option D. Lock the wheelchair and use proper body mechanics with assistance as needed. The correct answer is option D. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. Pulling can injure the patient and the assistant. Jumping is unsafe and unrealistic for a transfer. An unlocked wheelchair can roll and cause a fall. Question 31. An office review in a walk-in clinic shows that a pregnancy test performed in the office is classified as waived testing. Which requirement still applies? Option A. Skip controls because waived means unregulated. Option B. Use expired kits if the package is unopened. Option C. Report results before the test develops. Option D. Follow manufacturer instructions and quality control policy. The correct answer is option D. Follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Waived status does not eliminate quality responsibilities. Expired test kits may give unreliable results. Reading before the correct time can produce inaccurate results. Question 32. Given the workflow in an outpatient laboratory, the term dermatology appears in a referral. Which specialty is involved? Option A. Heart. Option B. Blood. Option C. Kidney. Option D. Skin. The correct answer is option D. Skin. Dermatology is the specialty focused on skin conditions. Cardiology focuses on the heart. Hematology focuses on blood and blood disorders. Nephrology focuses on the kidneys. Question 33. To protect safety in a clinical skills review, a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A. A normal calibration mark only. Option B. A properly grounded machine with still patient. Option C. Correct limb lead placement. Option D. Poor electrode contact or patient movement. The correct answer is option D. Poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Calibration marks do not explain baseline movement during tracing. Good grounding and stillness reduce electrical or motion artifact. Correct placement should reduce rather than create artifact. Question 34. As part of exam preparation in a walk-in clinic, the provider asks the assistant to perform a task prohibited by state law. Which action is appropriate? Option A. Clarify the concern and follow legal scope of practice requirements. Option B. Perform it because any provider request is automatically legal. Option C. Ask another assistant to do it secretly. Option D. Document that the patient requested it and proceed. The correct answer is option A. Clarify the concern and follow legal scope of practice requirements. Medical assistants must follow laws, regulations, and employer policy even when working under delegation. Delegation does not make a prohibited task legal. Passing on an improper task does not resolve the legal issue. Patient request does not override scope of practice limits. Question 35. Given the workflow in a women's health clinic, a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A. Increase oxygen without reporting the finding. Option B. Place the probe over wet nail polish. Option C. Warm the finger or choose a better perfused site. Option D. Ignore the waveform and record the lowest value. The correct answer is option C. Warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. Medication or oxygen changes should follow provider direction and clinical protocol. Moisture and polish can interfere with sensor performance. An unstable signal should be corrected before documenting the value. Question 36. As part of exam preparation in a same-day appointment, the assistant reviews the path of blood leaving the right ventricle. Which vessel receives it? Option A. Aorta. Option B. Pulmonary vein. Option C. Superior vena cava. Option D. Pulmonary artery. The correct answer is option D. Pulmonary artery. The pulmonary artery carries deoxygenated blood from the right ventricle to the lungs. The aorta carries oxygenated blood from the left ventricle to the body. Pulmonary veins return oxygenated blood from the lungs to the left atrium. The superior vena cava returns venous blood to the right atrium. Question 37. A medical assistant is working in a certification exam scenario when a claim requires the code for an office visit procedure or service. Which code set is used? Option A. CPT. Option B. Policy number. Option C. Zip code. Option D. YCD-10CM. The correct answer is option A. CPT. CPT codes describe medical procedures and professional services. A policy number identifies insurance coverage and does not describe the service. A zip code identifies location and is not a procedure code. ICD-10CM codes describe diagnoses and reasons for services. Question 38. Following office protocol in a primary care office, the urinary system is reviewed with a student. Which organ filters blood to form urine? Option A. Spleen. Option B. Gallbladder. Option C. Kidney. Option D. Appendix. The correct answer is option C. Kidney. The kidneys filter blood, regulate fluid balance, and form urine. The spleen filters blood cells and supports immune function but does not form urine. The gallbladder stores bile and does not form urine. The appendix is associated with lymphoid tissue in the digestive tract. Question 39. During a women's health clinic, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A. Abandonment. Option B. Beneficence. Option C. Coinsurance. Option D. Assault. The correct answer is option A. Abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Beneficence means acting for the patient's good. Coinsurance is a payment-sharing insurance term. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Question 40. While working in a pediatric clinic, a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A. Gently invert the tube the required number of times. Option B. Leave the tube unmixed until pickup. Option C. Shake the tube forcefully. Option D. Open the tube and stir with a swab. The correct answer is option A. Gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Failure to mix may cause clotting or poor specimen quality. Forceful shaking can cause hemolysis and inaccurate results. Opening the tube can contaminate the specimen and expose staph. Question 41. Given the workflow in a medication administration visit, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A. Skip technique instructions because home cuffs are automatic. Option B. Record readings with date, time, and relevant notes as directed. Option C. Use another person's readings if the cuff is shared. Option D. Write only the highest number ever measured. The correct answer is option B. Record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Proper positioning and technique still matter with automatic cuffs. Readings must belong to the patient. Selective recording can mislead clinical decisions. Question 42. For a patient encounter in a walk-in clinic, a patient has been drinking hot coffee immediately before an oral temperature. Which action should the medical assistant take? Option A. Switch to a rectal temperature without asking. Option B. Take the temperature immediately because oral readings are unaffected. Option C. Record the temperature as normal without measuring it. Option D. Await according to office protocol before measuring the oral temperature. The correct answer is option D. Wait according to office protocol before measuring the oral temperature. Hot or cold intake can temporarily alter oral temperature and lead to an inaccurate reading. Changing to an invasive route requires proper indication and protocol. Recent liquids can affect oral temperature results. Vital signs must be measured rather than assumed. Question 43. During a busy front office, a patient requests an appointment reminder by text message. Which consideration is important? Option A. Ignore all reminder preferences. Option B. Text any diagnosis to any phone number in the chart. Option C. Follow office policy and patient communication preferences. Option D. Post the reminder on social media. The correct answer is option C. Follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Preferences help guide appropriate communication. Sensitive information and wrong numbers can create privacy risk. Public posting would expose private information. Question 44. When a patient encounter unfolds in an exam room, a vial contains 100 mg per milliliter and the order is 50 mg. Which volume should be prepared? Option A. 0.5 milliliter. Option B. 5 milliliters. Option C. 10 milliliters. Option D. 1 milliliter. The correct answer is option A. 0.5 milliliter. Dividing the ordered dose by the available concentration gives 50 divided by 100, which equals 0.5 milliliter. 5 milliliters would provide 500 milligrams at this concentration. 10 milliliters would provide 1000 milligrams and is far above the ordered dose. 1 milliliter would provide 100 milligrams. Question 45. In a patient education session, the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A. Insulin. Option B. Estrogen. Option C. Thyroxine. Option D. Melatonin. The correct answer is option A. Insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Thyroxine is a thyroid hormone involved in metabolism. Melatonin is associated with sleep-wake cycles. Question 46. An office review in a primary care office shows that a specimen label is missing after collection. Which action is best? Option A. Write a name on the tube from memory. Option B. Ask another patient if the tube belongs to them. Option C. Follow facility policy for recollection or correction without guessing. Option D. Send the tube with no label and explain later. The correct answer is option C. Follow facility policy for recollection or correction without guessing. Unlabeled specimens create patient identification risk and must be managed according to policy. Guessing can cause a serious misidentification error. Patients cannot resolve specimen identity errors reliably. Laboratories commonly reject unlabeled specimens. Question 47. Before the visit continues in a family practice clinic, a staff member shares an electronic health record password to save time. Which risk is created? Option A. Better sterilization monitoring. Option B. Improved privacy protection. Option C, loss of accountability for chart access. Option D, automatic insurance approval. The correct answer is option C, loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Login credentials do not sterilize instruments. Password sharing weakens privacy and security. Passwords do not control payer authorization. Question 48. Given the workflow in a telephone triage workflow, a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A, file the result for review at the end of the month. Option B, discard the result because it is abnormal. Option C, notify the provider or designated clinical staff promptly. Option D, tell the patient the exact diagnosis without provider review. The correct answer is option C, notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Delaying a critical result can put the patient at risk. Abnormal results must be reported, not discarded. Diagnosis and interpretation belong to the provider. Question 49. An office review in a phlebotomy station shows that soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A, alcohol sanitizer is always illegal in clinics. Option B, soap and water help remove spores more effectively from the hands. Option C, gloves completely replace hand hygiene. Option D, hand washing is needed only before eating. The correct answer is option B. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Alcohol-based hand rubs are appropriate for many routine situations. Gloves reduce exposure but do not replace hand hygiene after removal. Hand hygiene is required at multiple points in patient care. Question 50. To protect safety in a primary care office, an intramuscular injection is ordered for an adult. Which site may be used according to protocol? Option A, a reddened rash site. Option B, inside a visible vein. Option C, the fingernail bed. Option D, deltoid muscle when the medication and volume are appropriate. The correct answer is option D, deltoid muscle when the medication and volume are appropriate. The deltoid can be used for certain adult intramuscular injections when volume and medication are suitable. Irritated or infected skin should generally be avoided. A vein is used for intravenous access, not intramuscular injection. The fingernail bed is not an intramuscular injection site. Question 51. When a patient encounter unfolds in a patient education session, the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A, packaging instruments makes cleaning unnecessary. Option B, organic material can interfere with sterilization. Option C, disinfection always destroys every spore. Option D, sterilization is the same as hand washing. The correct answer is option B. Organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Packaging dirty instruments traps contamination rather than preparing them safely. Disinfection reduces many organisms but does not reliably destroy all spores. Hand washing reduces microbes on skin but is not instrument sterilization. Question 52. The care team in a pediatric clinic asks for guidance because a medical assistant prepares to administer an injection. Which set best represents medication rights? Option A, right color of vial and right storage shelf. Option B, right diagnosis only. Option C, right patient, right medication, right dose, right route, right time, and right documentation. Option D, right insurance, right copay, right appointment, and right room. The correct answer is option C, right patient, right medication, right dose, right route, right time, and right documentation. The medication rights are safety checks used to prevent administration errors. Vial appearance and shelf location are not sufficient medication rights. Diagnosis alone is not enough to confirm safe administration. Administrative details do not replace medication safety checks. Question 53. After reviewing the situation in a primary care office, a patient receives a document explaining what the insurer paid and what may be owed. Which document is this? Option A, sterilization log. Option B, the advance directive. Option C, a progress note. Option D, explanation of benefits. The correct answer is option D, explanation of benefits. An explanation of benefits summarizes payer processing, allowed amounts, payments, and patient responsibility. A sterilization log tracks instrument processing, not claim payment. An advance directive communicates future care wishes, not payment information. A progress note documents clinical care, not insurance payment decisions. Question 54. Following office protocol in a walk-in clinic, the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A, double booking. Option B, wave scheduling. Option C, clustering. Option D, open hours. The correct answer is option A, double booking. Double booking places more than one patient in the same appointment slot. Wave scheduling schedules several patients to arrive at the beginning of a block. Clustering groups similar types of appointments together. Open hours allow patients to arrive without exact appointment times. Question 55. After reviewing the situation in a women's health clinic, the suffix itis appears in a medical term. Which meaning is most accurate? Option A, pain. Option B, removal. Option C, study of. Option D, inflammation. The correct answer is option D, inflammation. The suffix itis generally means inflammation. Pain is commonly indicated by the suffix algia. Removal is commonly indicated by the suffix ectomy. Study of is commonly indicated by the suffix logi. Question 56. While working in a cardiology practice, a sterile package is torn before a minor procedure. Which action is required? Option A, spray the package with disinfectant. Option B, tape the wrapper and use the contents. Option C, consider the contents contaminated and obtain a new sterile package. Option D, use the items if they look clean. The correct answer is option C, consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Surface disinfectant cannot sterilize items inside a compromised package. Taping does not restore sterility after the barrier is compromised. Clean appearance does not prove sterility. Question 57. For a patient encounter in a medication administration visit, a patient signs permission after the provider explains a procedure's risks, benefits, and alternatives. Which concept is demonstrated? Option A, abandonment. Option B, informed consent. Option C, battery. Option D, implied consent. The correct answer is option B, informed consent. Informed consent occurs when a patient agrees after receiving enough information to make a voluntary decision. Abandonment involves ending care without appropriate notice. Battery involves unauthorized touching or treatment. Implied consent is inferred from actions such as extending an arm for a blood draw. Question 58. After reviewing the situation in a treatment room, a capillary puncture is needed on an adult finger. Which side is generally preferred? Option A, the side of the middle or ring finger pad. Option B, the tip of the index finger. Option C, the center of the thumb pad. Option D, the little finger near the bone. The correct answer is option A, the side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The index finger is commonly used for touch and may be more sensitive or calloused. The thumb is often calloused and has a pulse, making it less preferred. The little finger has less tissue over bone and is usually avoided. Question 59. In a patient intake station, a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A, remove the band so it does not worry the patient. Option B, verify the allergy information in the record and with the patient. Option C, ignore the band if the patient seems healthy. Option D, give medication first and ask about allergies later. The correct answer is option B, verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Removing an alert without direction can create risk. Allergy risk is not based on appearance. Allergies must be checked before administration. Question 60. For a patient encounter in a preventive care visit, the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A, gallbladder. Option B, urinary bladder. Option C, thyroid gland. Option D, appendix. The correct answer is option C, thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. The urinary bladder stores urine and does not produce thyroid hormone. The appendix does not produce thyroid hormone. Question 61. In a primary care office, a chemistry panel requiring plasma is ordered and the facility uses heparin tubes. Which tube color is commonly associated? Option A, gray tube. Option B, green tube. Option C, light blue tube. Option D, lavender tube. The correct answer is option B, green tube. Green tubes commonly contain heparin and are used for certain plasma chemistry tests. Gray tubes are often used for glucose-related testing depending on protocol. Light blue citrate is used for coagulation testing. Lavender EDTA is typically used for hematology testing. Question 62. While working in a specialty referral visit, a patient says they cannot afford a prescribed medication. Which response is best? Option A, suggest sharing medication with a friend. Option B, tell the patient to stop all medications. Option C, ignore the comment because finances are private. Option D, notify the provider or appropriate staff so alternatives can be discussed. The correct answer is option D, notify the provider or appropriate staff so alternatives can be discussed. Cost concerns affect adherence and should be routed to the care team for appropriate options. Sharing prescriptions is unsafe and inappropriate. Stopping medication without provider guidance can be unsafe. The concern directly affects care and should be addressed respectfully. Question 63. During a women's health clinic, a claim requires the code that explains why a service was performed. Which code set is used? Option A, ICD-10-CM. Option B, NDC only. Option C, CPT. Option D, place of service only. The correct answer is option A, ICD-10-CM. ICD-10-CM codes report diagnoses and reasons for services. National drug codes identify medications and do not describe diagnoses. CPT codes report procedures and services rather than diagnoses. Place of service identifies setting, not the medical reason for care. Question 64. To protect safety in a procedure setup, an electronic record uses an audit trail. What is its purpose? Option A, track who accessed or changed information. Option B, measure blood pressure. Option C, sterilize instruments automatically. Option D, approve insurance claims instantly. The correct answer is option A, track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Vital sign measurement requires clinical equipment and technique. Audit trails do not process instruments. Payer claims processing is separate from record audit logs. Question 65. A medical assistant is working in a telephone triage workflow when the assistant removes soiled dressings from a wound. Which practice is appropriate? Option A, place the dressing on the clean supply tray. Option B, handle the dressing with bare hands. Option C, save the dressing in the patient's purse. Option D, use gloves and dispose of the dressing according to biohazard policy. The correct answer is option D, use gloves and dispose of the dressing according to biohazard policy. Soiled dressings can contain blood or body fluids and require barrier protection and proper disposal. Soiled material can contaminate clean supplies. Bare hand contact increases exposure risk. Biohazard waste should not be sent home in personal belongings. Question 66. Before the visit continues in a specialty referral visit, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, PASS. Option B, PERLA. Option C, HIPAA. Option D, ARICE. The correct answer is option A, PASS. PASS stands for pull, aim, squeeze, and sweep. PERLA describes pupil assessment. HIPAA governs health information privacy and security. RICE refers to rest, ice, compression, and elevation for certain injuries. Question 67. Before the visit continues in a diagnostic testing area, the provider asks the assistant to prepare for a visual acuity test. Which tool is commonly used? Option A, autoclave tape. Option B, hemostat. Option C, Snellen chart. Option D, tourniquet. The correct answer is option C, Snellen chart. A Snellen chart is used to screen distance visual acuity. Autoclave tape indicates exposure to sterilization conditions. A hemostat clamps tissue or small objects during procedures. A tourniquet helps locate veins for blood collection. Question 68. Following office protocol in a medical office workflow, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A, safety data sheet. Option B, patient intake form. Option C, the appointment reminder template. Option D, insurance remittance advice. The correct answer is option A, safety data sheet. The safety data sheet gives hazard, handling, storage, and spill response information for chemicals. An intake form does not provide chemical safety instructions. Reminder templates do not address workplace chemical safety. Remittance advice explains payment decisions, not chemical hazards. Question 69. After reviewing the situation in a preventive care visit, the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A, stream scheduling. Option B, prior authorization. Option C, matrix blocking. Option D, wave scheduling. The correct answer is option D, wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Stream scheduling assigns patients specific individual appointment times. Prior authorization is payer approval and is not a scheduling method. Matrix blocking reserves time unavailable for patient appointments. Question 70. The care team in an electronic health record review asks for guidance because a patient asks which body system includes the skin. Which system should be identified? Option A, integumentary system. Option B, urinary system. Option C, respiratory system. Option D, endocrine system. The correct answer is option A, integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The urinary system filters blood and eliminates urine. The respiratory system supports breathing and gas exchange. The endocrine system is made of hormone-producing glands. Question 71. When a patient encounter unfolds in a specialty referral visit, the provider asks for an instrument to examine the retina. Which instrument should be prepared? Option A, otoscope. Option B, reflex hammer. Option C, ophthalmoscope. Option D, centrifuge. The correct answer is option C, ophthalmoscope. An ophthalmoscope is used to view internal eye structures such as the retina. An otoscope is used for the ear canal and tympanic membrane. A reflex hammer tests reflexes and does not visualize the retina. A centrifuge separates specimen components and is not an eye exam tool. Question 72. While working in a busy front office, a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A, use the instruments if the package is dry. Option B, reprocess the instruments before use. Option C, write a new date on the package. Option D, open the package and rinse the instruments. The correct answer is option B, reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. A dry package alone does not override an expiration policy. Changing the date without reprocessing is unsafe and misleading. Rinsing does not restore sterility. Question 73. A medical assistant is working in a certification exam scenario when the provider mentions the largest artery in the body. Which vessel is being described? Option A, vena cava. Option B, pulmonary vein. Option C, aorta. Option D, carotid vein. The correct answer is option C, aorta. The aorta is the main artery carrying blood from the left ventricle to systemic circulation. The vena cava is a large vein returning blood to the heart. Pulmonary veins return blood from the lungs to the heart. Carotid structures are in the neck, but the carotid artery is not the largest artery. Question 74. The care team in a family practice clinic asks for guidance because lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, 4th intercostal space at the right sternal border. Option B, 5th intercostal space at the left midclavicular line. Option C, 4th intercostal space at the left sternal border. Option D, left arm below the clavicle. The correct answer is option A, 4th intercostal space at the right sternal border. V1 belongs at the fourth intercostal space on the right side of the sternum. That location corresponds to V4 in standard placement. That location corresponds to V2. The left arm electrode is a limb lead site, not V1. Question 75. Before the visit continues in a specialty referral visit, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A, axon. Option B, alveolus. Option C, ureter. Option D, platelet. The correct answer is option A, axon. An axon carries nerve impulses away from the neuron cell body. An alveolus is a lung air sac. A ureter carries urine from kidney to bladder. A platelet is a blood component involved in clotting. Question 76. A medical assistant is working in a treatment room when a glucose test requiring glycolysis inhibition is ordered. Which tube is commonly associated with this additive purpose? Option A, blood culture bottle. Option B, light blue tube. Option C, lavender tube. Option D, gray tube. The correct answer is option D, gray tube. Gray tubes commonly contain additives such as fluoride that help inhibit glycolysis for glucose testing. Blood culture bottles are used to detect bloodstream microorganisms. Light blue citrate is used for coagulation studies. Lavender EDTA is used mainly for hematology testing. Question 77. For a patient encounter in a specialty referral visit, the assistant prepares instruments for suture removal. Which item is commonly needed? Option A, tuning fork only. Option B, peak flow meter only. Option C, ophthalmoscope only. Option D, suture removal scissors or sterile scissors according to policy. The correct answer is option D, suture removal scissors or sterile scissors according to policy. Suture removal requires an appropriate cutting instrument and aseptic supplies according to the procedure. A tuning fork may be used in hearing or vibration tests. A peak flow meter measures expiratory airflow and does not remove sutures. An ophthalmoscope is used to examine the eye, not remove sutures. Question 78. Given the workflow in a diagnostic testing area, a patient has chest hair that prevents electrodes from adhering. Which action is most appropriate? Option A, ignore loose electrodes if the tracing prints. Option B, place electrodes over clothing. Option C, prepare the skin according to protocol to improve electrode contact. Option D, wet the electrodes with tap water only. The correct answer is option C, prepare the skin according to protocol to improve electrode contact. Good skin preparation helps electrodes adhere and improves tracing quality. Loose electrodes can create artifact and poor quality results. Electrodes must contact skin to record electrical activity. Unapproved moisture does not replace proper skin preparation. Question 79. A medical assistant is working in a family practice clinic when the suffix ectomy appears in a procedure term. Which meaning is most accurate? Option A, abnormal softening. Option B, visual examination. Option C, inflammation. Option D, surgical removal. The correct answer is option D, surgical removal. Ectomy means surgical removal of a structure. Abnormal softening is indicated by malacia. Visual examination is often indicated by scopy. Inflammation is indicated by itis. Question 80. As part of exam preparation in a women's health clinic, a patient questions a medication that looks different from the usual dose. Which response is safest? Option A, pause administration and verify the order and medication. Option B, give the medication quickly before the patient refuses. Option C, document that the patient was difficult and continue. Option D, tell the patient that questions are not allowed. The correct answer is option A, pause administration and verify the order and medication. A patient concern can identify a potential medication error, so verification is required before proceeding. Rushing increases risk and ignores a safety concern. Labeling the patient does not resolve the possible medication issue. Patients should be encouraged to participate in safety. Question 81. Given the workflow in an administrative check-in area, a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A, offer water by mouth immediately. Option B, activate emergency response and assess breathing according to training. Option C, move the patient to a chair before assessing. Option D, finish documenting the previous visit. The correct answer is option B, activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Giving oral fluids to an unresponsive patient risks aspiration. Unnecessary movement can cause injury and delay assessment. Documentation should not delay emergency care. Question 82. While working in a telephone triage workflow, a patient wants information released to a spouse. Which documentation is usually needed? Option A. A note written by the assistant after the fact. Option B. A valid authorization or permission according to office policy. Option C. A verbal request from the spouse only. Option D. No documentation because spouses always have full access. The correct answer is option B. A valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. Authorization should come from the patient or legal authority. The spouse's request alone may not authorize release. Relationship alone does not automatically grant full access to records. Question 83. In a treatment room, the medical assistant takes a phone message for the provider. Which information is most important to include? Option A. The assistant's guess about the diagnosis. Option B. Caller identity, contact information, reason for call, and urgency. Option C. Only the caller's first name. Option D. A promise that medication will be prescribed. The correct answer is option B. Caller identity, contact information, reason for call, and urgency. Complete phone messages help the provider triage and respond appropriately. Diagnosis should not be guessed in a phone message. A first name alone may not identify the patient or issue. Medication decisions belong to the provider. Question 84. Following office protocol in a pediatric clinic, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A. Ask the patient to walk faster. Option B. Tell the patient dizziness is impossible. Option C. Leave the patient standing while searching for forms. Option D. Assist the patient to sit or lie down safely. The correct answer is option D. Assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. Walking can increase fall risk when the patient is dizzy. Dismissing symptoms does not protect patient safety. An unsteady patient should not be left unsupported. Question 85. An office review in a treatment room shows that a pain score is being collected during intake. Which approach is best? Option A. Ask the patient to rate pain using the office's standard scale. Option B. Assume pain level from facial expression only. Option C. Change the score to match the assistant's opinion. Option D. Tell the patient pain is not part of vital signs. The correct answer is option A. Ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. Facial expression alone may not reflect the patient's reported pain. The pain score should reflect the patient's report. Pain assessment is commonly included in intake workflows. Question 86. At the start of care in a family practice clinic, a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A. Fowler. Option B. Supine. Option C. Sims. Option D. A prone. The correct answer is option B. Supine. Supine means lying on the back facing upward. Fowler position is seated or semi-seated. Sims position is side-lying with one knee flexed. Prone means lying face down. Question 87. While working in a medication administration visit, the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A. Fast breathing. Option B. Slow heart rate. Option C. High blood sugar. Option D. Inflammation of the liver. The correct answer is option B. Slow heart rate. The prefix brady means slow, and cardia refers to the heart. Fast breathing is tachypnea rather than bradycardia. High blood sugar is hyperglycemia. Inflammation of the liver is hepatitis. Question 88. After reviewing the situation in an electronic health record review, the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A. By mouth. Option B. As needed. Option C. Immediately. Option D. Every morning. The correct answer is option B. As needed. PRN means the medication is taken as needed according to the order. By mouth is PA. Immediately is stat in common medical usage. Every morning is commonly abbreviated differently and is not PRN. Question 89. To protect safety in a family practice clinic, a patient asks for a copy of their medical record. Which action should the assistant take? Option A. Follow the office release of information process. Option B. Delete sensitive information before the request is reviewed. Option C. Give the record to anyone who asks. Option D. Refuse because records belong only to the provider. The correct answer is option A. Follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Altering the record is inappropriate and may violate legal requirements. Identity and authorization must be verified before disclosure. Patients have rights to access their health information under applicable rules. Question 90. Following office protocol in an electronic health record review, a used needle must be discarded after an injection. Which practice is safest? Option A. Activate the safety device and place the needle in a sharps container. Option B. Recap the needle with both hands. Option C. Place the needle in regular trash. Option D. Carry the needle to the front desk for disposal. The correct answer is option A. Activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Two-handed recapping increases needle stick risk. Sharps can injure staff and must not go into regular trash. Transporting exposed sharps through the office increases risk. Question 91. The care team in a primary care office asks for guidance because the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A. Finish all remaining patients before telling anyone. Option B. Hide the incident if there is no bleeding. Option C. Place a bandage on the site and ignore it. Option D. Wash the area and report the exposure according to protocol. The correct answer is option D. Wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. Delaying reporting can delay needed evaluation and follow-up. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Covering the wound alone does not address exposure risk. Question 92. When a patient encounter unfolds in a telephone triage workflow, the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A. The pulse oximeter will stop working. Option B. The oral temperature will decrease. Option C. The patient will automatically faint. Option D. The reading may be inaccurate. The correct answer is option D. The reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Blood pressure cuff alignment does not control the pulse oximeter. Cuff placement does not change oral temperature. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Question 93. Given the workflow in an infection control audit, a patient asks for printed medication instructions. Which practice improves health literacy? Option A. Tell the patient to search online without guidance. Option B. Use only complex medical terminology. Option C. Use clear language and review the key points with the patient. Option D. Provide instructions in the wrong language. The correct answer is option C. Use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Unguided online searching may provide inaccurate or confusing information. Complex terms can reduce comprehension. Language mismatch can prevent safe understanding. Question 94. In an urgent care office, a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A. The electrodes inject medication. Option B. The test shocks every patient to start the heart. Option C. The machine draws blood through the wires. Option D. The test records electrical activity and does not deliver a shock. The correct answer is option D. The test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. Electrodes record signals and do not inject medication. A standard electrocardiogram does not deliver electrical therapy. Electrocardiogram leads do not collect blood. Question 95. During a medical office workflow, office supplies are consistently running out before the next order date. Which administrative action is best? Option A, track usage and adjust par levels according to office needs. Option B, wait until every item is completely gone. Option C, order random supplies without reviewing use. Option D, hide supplies from the provider. The correct answer is option A, track usage and adjust par levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Waiting can interrupt patient care and office workflow. Unplanned ordering can waste money and storage space. Hiding supplies does not solve inventory management. Question 96. For a patient encounter in a walk-in clinic, a patient is crying after receiving difficult news from the provider. Which nonverbal behavior is supportive? Option A, keep checking messages during the conversation. Option B, stand over the patient with crossed arms. Option C, laugh to lighten the mood immediately. Option D, sit at eye level and allow silence when appropriate. The correct answer is option D, sit at eye level and allow silence when appropriate. Calm presence, appropriate eye level, and respectful silence can support a distressed patient. Distracted behavior suggests the patient is not being heard. Closed posture and standing over the patient can seem intimidating. Humor can be inappropriate when a patient is distressed. Question 97. Before the visit continues in an exam room, the assistant scans a signed consent form into the wrong patient's chart. Which action is best? Option A, ask the patient to sign a blank form. Option B, delete the form and tell no one. Option C, leave it because both patients use the same clinic. Option D, report and correct the filing error according to policy. The correct answer is option D, report and correct the filing error according to policy. Misfiled records can affect patient care and privacy, so they must be corrected properly. Blank forms do not correct the misfiled record and are inappropriate. Unreported deletion can worsen the documentation error. Clinic use does not make one patient's document appropriate in another chart. Question 98. When a patient encounter unfolds in a women's health clinic, a patient reports dizziness when standing and the provider requests orthostatic measurements. Which approach is most appropriate? Option A, measure blood pressure and pulse in different positions according to protocol. Option B, measure only oxygen saturation while the patient is seated. Option C, record the first seated blood pressure as orthostatic. Option D, have the patient walk quickly before the measurement. The correct answer is option A, measure blood pressure and pulse in different positions according to protocol. Orthostatic vital signs compare cardiovascular response to position changes. Oxygen saturation does not assess the blood pressure and pulse changes requested. A single seated reading does not show positional change. Exertion can distort the readings and increase fall risk. Question 99. Before the visit continues in a certification exam scenario, an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A, change only the paper on the exam table. Option B, clean and disinfect touched surfaces according to office protocol. Option C, spray disinfectant and wipe it off immediately every time. Option D, open the door to air out the room only. The correct answer is option B, clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. The exam table paper does not address other touched surfaces. Disinfectants usually require the manufacturer's contact time to work properly. Ventilation alone does not remove organisms from contaminated surfaces. Question 100. A medical assistant is working in a certification exam scenario when a co-worker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A, routine scheduling. Option B, appropriate marketing. Option C, breach of confidentiality. Option D, quality control testing. The correct answer is option C, breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Scheduling does not involve posting private health information publicly. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Quality control relates to test system accuracy, not social media disclosure.